FORA.tv. The world is thinking.
Yeah, I'm kind of pessimistic about what's gone on in Washington. I don't think this summer was fruitful for people like me who believe in universal coverage. And I don't think we're going to get it out of Washington this fall. I'm sure they'll pass a bill, and I'm sure the Democrats will declare victory. But I don't think it'll get us anywhere near the standard of health care for everybody that we see in the other rich countries. So how are we going to get there? Well, you don't want to hear me say this, but in my book, I definitely explain this because I have a chapter in there about Canada. As I said, Canada is a pretty good system. It covers everybody. It spends half as much as we do. They do keep people waiting, although that's not a function of the system. Taiwan and Korea, using the same system, have shorter waiting times than the United States. But here's what happened in Canada. That national Medicare system started in 1944 in one state, in one province. They elected this lefty guy who called himself a socialist to be their governor. They call him premier. And he set up a state-run single-payer system. Everybody paid a premium. He didn't call it a tax, a premium, to the government of Saskatchewan, and anybody in that province could go to the doctor for free. And it really worked. A lot of doctors kind of flocked there because they knew they'd get paid, and it worked fine. The system worked fine. And other provinces saw this and copied it. This is what the economists call the demonstration effect. One state made it work, and the others saw it, and by 1961, it was so popular that even those snobs out on the East Coast provinces had to go along, and Ottawa made it apply to everybody in Canada. That's how they got there, state by state. And the guy, as I said, the premier of Saskatchewan who started this was a socialist named Tommy Douglas, and he always fought for this and always argued that this was the way to go. Canadians love this system. It exactly fits their egalitarian moral structure. It's fair to everybody, and they love that in Canada. And they love Tommy Douglas. And get this, in 2004, the Canadian Broadcasting Company took a poll. They polled millions of Canadians. Who is the greatest Canadian in history? And the candidates included Wayne Gretzky. Yes. Alexander Graham Bell, they claim him. Pierre Trudeau, who was their JFK, et cetera, and the winner was Tommy Douglas, the guy who created Medicare and made health care available to all Canadians. And I've said, I talked to a lot of state legislators, I've said to many legislators, you know, if you would set up a state-run system that worked, you'd be the greatest American in history. You know, it could happen here. And since Washington is not going to get this done, I'll bet you next January there will be bills in 25 state legislatures looking for a way to do this. And, you know, let's have the policy laboratory. Let's try 7 or 8 different measures. Massachusetts tried, and they got to 98% coverage, which is absolutely valuable, but they didn't do anything about costs. They put everybody into these expensive private insurance plans, which is not sustainable on a cost basis. But let other states try. My guess is we will get there state by state. You guys almost did it. Both houses of your legislature passed a bill that would have provided health care for everybody in California. California is often a leader on social policy in the United States. You could do it. Maybe Colorado will beat you to it. But I think state by state, some states will make something work and the rest will see it and it'll work. So I'm now kind of betting on a Canadian model to get to universal coverage in the United States.